lot of people in the African American community choose not to get their children diagnosed based on some mistrust, and then also cultural stigma that is faced when they have a child who has been labeled as ADHD, and then the lack of awareness and education and fear of just the medication and what that means when you have a child who has ADHD. There's a huge bias in the African American community when it comes to just referring kids to be diagnosed. One of the things that we do find is that because parents in the African American community, we want more for our children's behavior to be normalized, and so when we refer to the fidgeting, the hyperness, them inattentive ways and behaviors, what we say is that, oh, they're just being bad, or they're being rebellious. And so the last thing that we would like to label is our child to be ADHD. So we just come up with normal ways, normal behaviors to kind of normalize that. So definitely bias in referral, and especially just to piggyback on like in the educational system, what I find is that when parents are going to the teachers and saying, well, that's just his behavior, well, then the teachers are probably more prone to be biased, prejudgmental towards, okay, it might not be something wrong with that child. I might have to buy into what the parent is saying about the child just being bad, and so then that changes their whole perception of the child. Then we start looking at assessments, and we start working on clinical interviews and just trying to figure out, okay, what is going on? So just trying to get to the root of the problem of where everything is stemming from, such as the anger, even if they are in a violent situation, when they come into the counseling center, those are things that they could feel safe about talking about. And so then we link with other psychiatrists or other psychologists in the community and say, hey, we got a kid who we have completed some screenings on, who definitely kind of show some signs of ADHD, and so can we send them over to you? And then we get the parents to pretty much buy into, hey, look, we did an assessment, this is what this looked like, and here's how we can try to help your child educational wise. And then not only that, but we're educating the community, the parent, about some of the symptoms, and then they can take it back home, because we don't only educate, we teach them different ways to kind of help, and then we link them up with another provider. And so we all become like an integrated team together. So now you have the school system, you have the counseling portion of it, and then you also have the parents and the child all involved on the same team. Also, one of the things that I really love about the DSM-5 this time is the CFI, the cultural formulation interview that they incorporated in this one, that really helps a lot with understanding where that family comes from, what are some barriers, what would prevent them from getting intervention, and so it takes the therapist into a different stage of, okay, let me, from this cultural formulation interview, let me kind of look at it and go, how can I help this family? How can I be a resource to this family? Let me forget about what I know of, from a medical perspective or from a therapeutic perspective. Let me just put all that to the side, and let me just kind of focus on this family right here. And based on what they just told me from their culture and any cultural barriers that may exist, how can we go around to making sure that they get the assistance that they need? If a child already has heard these things as far as they're bad, they have negative behavior, they make bad choices themselves, sometimes they kind of adapt to that, you know, and so sometimes they do make it, because if that's the only way that they can get attention, then that's exactly what they do. So you'll find that more in boys. You know, they'll say, well, everybody else tell me I'm bad, so I'm gonna just be bad, in the African American boys. And what I try to kind of just impose on them is that you're not bad, you're making bad decisions, and so we have to figure out how to make the best decisions, you know. So just changing the words, that's one of the things. Another thing is that remembering, sometimes it's the role reversal. Young men in the African American community, if they live with single parents, then they're already taught that they need to be the head of the household. And so it can start at any age. So you can have a 4-year-old who have been saying, you're going to take the trash because you're the man of the house. And so that's a role reversal. Now you've went from being a child to already being an adult taking care of the household. And so when you get to school, you know, you think you the man of the house at home. So guess what? You're going to think you're the man of school, of the classroom. And so that's one of the things that you'll find, is because these are some things that have been embedded in you. You know, stand up straight. You have to act like a man, you have to think like a man, you have to talk like a man, you know. And then it's always instilled in the African American male, you know, we have to, they have to think about the perception of others. So you have to talk straight, walk straight, you know, and then that can become rebellious. And those can be signs of kids who are struggling with it. And then that can give them defense mechanism, you know, that can show signs of oppositional defiant disorder, because they haven't even been able to be a kid. And so now here they are, you know, 10, and they have been taught that they are the man of this household and they have to act like a man. And so I think those are some of the symptoms that you would find in kids who have ADHD, but that might not be in the screenings or in the DSM, those outside factors that influence that behavior. If the child is being diagnosed with ADHD, or if it's an adult who's being diagnosed with ADHD, building that relationship to understand who's all a support system for that particular client is huge in the African American community. So starting where they are and then recognizing the support systems that they have, I believe that the client will have a better outcome. The treatment plan will be more effective if those two things are done in the very beginning, and then we can alleviate a lot of the things as far as, you know, inaccurate diagnosis, missing appointments, stopping treatment. I think those can actually be alleviated if those two things are, you know, looked at first.